One evening, after returning home from work, Alia developed an extremely high temperature. What was really wrong with her? Few diagnostic tests revealed that Alia was suffering from malaria. But how did she get infected with malaria in the first place? What could have caused it? And how did this infectious agent take over her body? So friends, without wasting our time, let's learn about this infectious disease in detail. To begin with, let's first take a look at the epidemiology. Most of the tropical nations like Southeast Asia, Latin America, and others are endemic to malaria, and India is one among them. It is a serious disease that disables and kills an estimated 60,000 people every year, and most of them are children under the age of 5. Though half of the world's living population are at risk of malaria, it is one of the deadliest diseases in human history. Not only in slums and villages, but also in big cities, these mosquitoes can typically be found laying eggs in stagnant water. Even a small lid with fresh water is enough for them to breed. Now let's see the life cycle of these parasites. Part 1. Infection. Malaria is transmitted among humans through an infected female Anopheles mosquito. The process starts when an infected insect lands on its victim and pierces their skin with a proboscis, a long straw-like extension with pointed ends so she can obtain a blood meal from the host. As she feeds, Plasmodium sporozoite contracted from other humans and in rare cases animals are transferred from her body directly into the bloodstream of the victim. Even before the person realizes, thousands of Plasmodium sporozoites would have already entered his blood. Part 2. Replication in the human liver. The sporozoites travel through the blood vessels and migrate to the liver. These sporozoites invade in the liver cells where they grow and reproduce asexually into merozoites. At this stage, no symptoms are present, and the parasite can remain dormant for months or even several years. The multiplying merozoites then rupture the liver cells and invade the bloodstream. Part 3. Infection of red blood cells. Traveling through the blood vessels, the merozoites infect new red blood cells and initiate a series of multiplying cycles producing new infective merozoites. These blood stage parasites are the ones which cause the symptoms of malaria. The parasites grow and multiply inside red blood cells until they burst, releasing daughter merozoites that continue the cycle by invading other red blood cells. Symptoms. People with malaria often experience severe headache, generalized muscle and joint pain. The symptoms of malaria also include chills and intermittent high-grade fever around 40 degrees Celsius or 104 Fahrenheit, along with nausea and severe vomiting. Investigation. To diagnose malaria, your doctor will likely review your medical history, recent travel, and may also conduct a physical examination. Diagnosis of malaria can be confirmed by carrying out blood tests. Blood test can indicate the presence of parasite in the blood or which type of malaria parasite is causing your symptoms. Under the microscope, these Plasmodium falciparum have trophozoite ring form. Treatment. The most common anti-malarial drugs include chloroquine, hydroxychloroquine, mefloquine, and other symptoms are treated accordingly. Prevention. To protect yourself, apply mosquito repellent cream in regular intervals, especially between dusk and dawn time when mosquitoes are most active. Cover your skin by wearing long-sleeved shirts and pants while going out. Take steps to avoid mosquito bite by spraying mosquito repellent inside your home. Sleep under a net, particularly those treated with insecticides. Mosquito fogging machine is also effective. Recently, a new vaccine named R21 Matrix M appeared, and it seems that it is much more effective than Muscarix. Along with these preventive measures, let's stop these mosquitoes by keeping our villages and cities clean. Presented by Sushmita Pillai, Anthony Adarsh, Francina, Manohar, Special thanks to Nurse Larisa Alexievna and Dr. Rustam from Regional Prophylactic Center. Also our lovely friend Bharvi.